Our keynote speaker is an associate professor at the Keck School of Medicine in the Department of Preventive Medicine. She is also the director of the Global Health Program of the Association of Pacific Rim Universities, a nonprofit network of 56 leading universities in the region. Meaning the Asia Pacific region. She earned her PhD from the Department of Community Health Sciences at UCLA, her MHS in International Health at Johns Hopkins Bloomberg School of Public Health, and a BA in International Development at UC Berkeley. She is the editor of 2 books, Global Perspectives on Sexual and Reproductive Health Access Across the Life Course, and Global Health Leadership Case Studies from the Asia Pacific. She also writes a blog on human trafficking on Psychology Today. Ladies and gentlemen, I'm quite honored to present to you Dr. Mellissa Withers.
Thank you so much. Thank you for that nice introduction. And thank you so much for inviting me to speak today. I'm really, it's a great honor to be here. And I'm sorry that we're not doing this in person. I would have loved to get together with you all. I've been to the Philippines a couple of times, and my 3 favorite things there are the beautiful beaches, the wonderful mangoes, and of course the fantastic people. So let me go ahead and share my screen here. Okay, let's get started. So as Dr. Assor mentioned, my talk is called Politics, Public Health, and the Pandemic, How Immigrants in the United States Have Been Impacted. So this is an overview of what I'm going to discuss. So let's get started with the background. So let's follow a typical American family during their day. Of course, probably not during COVID time, but in a normal day. They wake up and they wear garments made in Bangladesh. They drink Colombian coffee. Their alphabet is Latin. They prepare their lunch with foods coming from Mexico and other Latin American countries. Hop into their German car with gasoline made from Saudi Arabian oil. Go to lunch at a restaurant owned by Italians with a menu with numbers in Arabic, from Arabic. They drink some French wine for dinner and end the day watching TV made in China or Japan. But yet when they go to the polls to vote, they may vote for the most anti-immigration candidate. We in the United States have a very complex relationship with immigration, but the COVID-19 pandemic is a prime example of the many benefits that migration can bring to countries. But it also has helped illustrate the gross inequities within our societies and why immigrants have been so negatively impacted. And it also has highlighted the gaps in data collection that prevent us from understanding the full picture. So there are about 232 million international migrants worldwide, representing about 3.2% of the world population. The United States attracts about 20% of the world's international migrants, even though it represents less than 5% of the global population. That means that 1 in 7 people in the United States is foreign born, close to 50 million people. Immigrants account for about 13% of the total 333-ish million US residents. But if you add the US born children of immigrants, that means that approximately 1/4 of the overall US population is actually first or second generation. You can see in the United States that about half come from Latin America and close to 1/3 come from Asia. So since this is a conference in the Philippines, I'm going to ask you, how many Filipino migrants are there worldwide and how many are in the US? So think about it for a second, get your guess ready. And I'm going to tell you now. So there are, according to this, about more than 5 million global migrants from the Philippines and more than 2 million in the United States. In fact, if you look at a map of the United States, excluding people from Mexico, if you look at the most common country of birth for foreign-born residents, you will find that Filipinos are the most common in 5 states, including Alaska. So as we all know, the COVID-19 pandemic has hit 192 countries around the world with about 113 million diagnosed cases and 2.5 million deaths. In the United States alone, we've had almost 29 million cases diagnosed, and we just hit over 1.5 million deaths. Not unique to the United States, studies from a number of countries have found that COVID-19 infection risk among immigrants is at least twice as high as that of native born. And COVID-related mortality rates for immigrants are significantly higher as well. But we don't have a lot of data to truly understand this phenomenon because why? We don't collect disaggregated data by country of origin. And this is both in the United States and in many countries around the world. But if we look at racial and ethnic minority groups in the United States, we can see that they are 3 times as likely to become infected as their white neighbors and nearly twice as likely to die from COVID as whites. And in particular, Latinos ages 40 to 59 have been infected at 5 times the rate of white people in the same age group. And the differences are more stark when you look at deaths. Of those Latinos who died, more than 1/4 were younger than age 50, compared to only 6% among whites. So how do we explain this? Well, there are numerous social determinants of health, which increase the vulnerability of immigrants in the United States to COVID-19. So let's take a look at some of them. We know that people from racial and ethnic minority groups and migrants are more likely to have lower education levels. Lack of education may limit future job options and lead to lower paying jobs or even less stable jobs. We've also found that in recent studies, consistently, ethnic minorities and immigrants have lower levels of knowledge about COVID-19, like personal prevention practices, symptoms, and when to seek care. We also know that language barriers often prevent people from seeking care as well. High poverty levels make the foreign-born more vulnerable, and research shows that those in poverty are more likely to have underlying health conditions associated with higher rates of hospitalization and death from COVID-19. They're also disproportionately affected by difficulties in finding affordable and quality housing. So let's take one example. Let's take this guy here, Mario. We'll call him. Due to a lack of educational opportunities, Mario wasn't able to find a decent job in his home country of El Salvador, which is also extremely dangerous due to high murder rates. So he came to the United States with his mother, his wife, and their 2 children, and live in a crowded 1-bedroom apartment with another couple. So 7 of them living together. Crowded multi-generational households are common among immigrants. This means that his elderly mother has regular exposure to others, and she, as an elder person, is at increased risk of severe illness due to COVID. We know that immigrants live in places where COVID-19 deaths and infection rates are highest. Again, while our Centers for Disease Control does not provide data on COVID-19 infection or mortality rates by nativity or citizenship, we know that places that have higher populations of immigrants, such as urban coastal areas, have higher COVID-19 mortality rates. Immigrants and people from racial ethnic minority groups are disproportionately affected by lack of access to quality health care and to health insurance. These barriers increase risk of poor health outcomes. So the health insurance coverage rate among native-born residents in the US is about 93%. For foreign-born residents, it's 81%. But if you look at non-citizen foreign-born residents, it's 71%. And if you look at undocumented migrants, it's only 53%. Another important determinant in the COVID pandemic has been racism, fueled by the previous administration. Trump called COVID-19, quote, the China virus. He called it a hoax, and he blamed China for, quote, mass worldwide killing. Last year, anti-Asian hate crimes in the United States significantly increased, and this problem is especially evident in areas with large Asian populations like California and New York, where the COVID-19 outbreaks were especially bad. For example, in New York, the police department reported an 8-fold increase in these crimes in 2020 as compared to 2019. Let's look at another determinant, labor. More than 1 in 6 workers in the United States was born abroad. That represents 28 million workers, about 17% of the workforce. But immigrants are concentrated in occupations critical to keeping our societies going during COVID-19. About 67% work in occupations designated as essential occupations. That means close to 20 million people. And if you look at the undocumented workforce, about 3/4 of this workforce are in sectors that are classified as essential. Compare this to only about 1 in 4 white workers who held such jobs. Working in essential industries, as we know, compels them to work during stay-at-home orders and other orders that shielded people from risk of infection. These jobs require frequent or close contact with the public or other workers. So let's go back to that typical American family that I mentioned. 29% of all the physicians that family might visit are immigrants. 38% of home health aides that may be taking care of their parents are immigrants. 22% of workers in the US food industry that help keep Americans fed are immigrants. 1/3 of our agricultural workers, crop production workers are immigrants. And in California, where I live, it's actually 69% of agricultural workers are immigrants. 37% of our meat processing industry workers are immigrants. 16% of the nearly 3 million grocery workers are immigrants. And 34% of metro, bus, and taxi drivers are immigrants. If you look at this chart, you'll see for healthcare and social services, it's a similar trend, from registered nurses to personal care, physicians, home health aides, social workers. About 3 million of these workers are foreign born. This map shows you the most commonly held jobs by immigrants and by state. And you'll see that in many states, it's agricultural workers, it's construction workers, cooks, home health aides, nurses, people that kept our economy going during COVID-19. So immigrants provide the manpower and drive needed to fuel economic growth. They work in lower skilled service sector jobs, but also in high skill occupations like healthcare. Many though work in informal jobs with no pay if they don't work and no sick leave. For example, we saw more than 16,000 infections tied to meat and poultry processing only in 2 months last year. But many states don't even provide data, and many food processing companies refuse to provide case totals. But we saw a number of similar large outbreaks on farms, in fruit processing plants, and even at plants where pet food is made. So as I mentioned, foreign-born workers make up more than 17% of the workforce, but they also create about 1/4 of new businesses in this country. Entrepreneurship, as you know, especially that small size businesses, is a risky financial endeavor. Only about 41% of businesses in this country exist after 5 years. Immigrant-owned businesses have been more vulnerable to the impact of COVID-19. Immigrant entrepreneurs were more likely to lose their businesses during the first few months of the pandemic compared to others. Business fell by 36% between February and April of last year, which was double the rate of US born business owners. Immigrants own about 22% of businesses in higher risk industries, and Asians in particular disproportionately own businesses in these higher risk industries. We also saw that foreign-born workers are more likely to work in occupations that reached the highest unemployment rates during COVID-19. 6 million immigrant workers worked in industries that laid off huge numbers of workers. That includes 38% of chefs and head cooks that are immigrants, and 52% of maids and housekeepers that are immigrants. So in the first few months of the pandemic, approximately 1 in 5 foreign-born workers lost their jobs. So we know immigrants have lower income, often greater debt, difficulties with affordable housing, nutritious food, making even childcare difficult, but yet they lack government assistance. So let's take the case of Christina. She lost her job as a nanny, but she's ineligible for unemployment benefits, federal benefits. So even though the government gave families as much as $5,000 US in relief checks and loaned millions and millions more in assistance to small businesses, she didn't qualify. In fact, more than 15 million immigrants and people living in households with mixed immigration status were not eligible for these payments. The estimated $2 trillion US pandemic aid package makes many immigrants eligible for some cash relief payments, but many will not be eligible. So they face restricted access to safety net programs, food stamps, and unemployment insurance, medical care, et cetera. And of course, the undocumented immigrants face the worst conditions. Other social determinants to think about. One was distance learning. School closures and distance learning put in place to slow the spread of the COVID-19 pandemic put children of immigrants at a disadvantage in several ways. This is a photo of 2 little girls who were found with their computers, their tablets, outside of a Taco Bell fast food restaurant using the Wi-Fi because they didn't have Wi-Fi access at home. They have fewer resources. Their parents can't help them with their homework, often because they don't speak the language. In fact, 40% of native-born children of immigrants do not speak the host language at home. And they're less likely to have access to a computer, an internet connection, or a quiet place to study. We also know that lack of technology has affected immigrants disproportionately in terms of making telehealth appointments, making vaccine appointments, or even accessing accurate information about COVID-19. And of course, we've seen that fear of immigration authorities and the many arrests that were done under Trump have also created barriers to testing, to getting healthcare, and now to getting vaccines. So I want to talk a little bit about U.S. immigration policies, and now looking forward. Let's not look back, but what can we hope for? Well, President Biden revoked a Trump-era ban on legal immigration for family members of U.S. citizens and residents, as well as the ban on the diversity visa lottery recipients. So basically, Trump reduced legal immigration by about 49% since becoming president. And he did this without any changes to the US immigration law. Reducing legal immigration harms refugees, but also employers and our society. It affects the country's labor force and economic growth. One program was known as the Green Card Lottery, which is a US government lottery program making available about 55,000 immigrant visas every year. And it aims to diversify the immigrant population in the United States. And it selects, in particular, applicants from countries with low numbers of immigrants in the previous 5 years. About 14 million people apply each year. But last year, this program was halted in the name of protecting American workers and the US labor market, given the coronavirus pandemic. Immigrants had been deemed, quote, a risk to the US labor market. So immigrants were no longer allowed to bring family members over. And of course, the lottery was banned, and it also barred entry to immigrants with employment-based visas, even those who had already been approved. The denial rate on new petitions for highly skilled foreign nationals is increased from only about 6% denials in 2015 to more than 30% denials last year. So again, immigrants and guest workers were considered a threat to the US labor market. We also have to consider international students. Many work in skilled jobs in science, technology, engineering, etc. International students account for more than half of our master's degrees and about 44% of doctorate degrees. And employers often recruit highly skilled international students to become employees. Another policy that was recently repealed is family separation. So this is, quote, zero tolerance program led to the separation of over 3,000 migrant families. So although the practice of separating migrant children from their parents was ended in 2018, the policy of zero tolerance, which basically directs attorneys to prosecute anyone who crosses the border illegally, was never officially rescinded. Another ban, Biden suspended on his first day in office, the public charge rule. So this rule basically created a presumption that immigrants with incomes below a certain threshold were going to use welfare at some point. And so we should keep them out. It also had complicated data requirements which force applicants to produce all kinds of financial records and documentation on almost an unimaginable scale, requesting information that many people didn't even know, didn't possess. And in particular, the DHS even started denying anyone who left something blank on an application, like current addresses for deceased parents. So another something we can look forward to is the end of this practice of last year. Basically, Trump also effectively ended asylum at US land borders by invoking a power given to the Surgeon General in 1944 that says he could block the entry of foreign nationals who, quote, pose a public health risk. This injustice, by blocking almost all asylum applications from refugees, violates both American and international law. It also categorically denied people who were fleeing gender-based persecution and mandated the virtual automatic expulsion of unaccompanied minors crossing the border. So during that time, by March 2020, under Trump, almost 70,000 asylum seekers had been put back into Mexican border cities. So what else can we expect looking ahead? President Biden has promised a more fair, orderly, and humane system and has already implemented many changes to immigration policy, with many more expected in the years ahead. He issued a moratorium on all immigration enforcement for 100 days, except for people who have committed acts like terrorism and espionage crimes. He wants to reverse the travel ban on Muslim people coming from Muslim nations, stop construction of the wall, increase the diversity lottery system for visas to 80,000 per year. He vowed to help Central American countries address the root causes of migration, a change in US immigration law with the term alien to become non-citizen, and also propose a fast track to citizenship for young, quote, dreamer immigrants who are brought to this country by their parents. So public health and immigration policies must be informed by more research and specific data to better protect the health and well-being of immigrants. All indicators suggest that immigrants and their children have been disproportionately negatively affected by the pandemic and are likely to continue to be highly affected. So I just thought about some potential research ideas of what we could do. In the long run, immigration restrictions stifle economic and scientific innovation of the very type that is essential in these types of crises. Let me give you some examples. Moderna, the first company to ship a vaccine, and the one I'm going to get on Tuesday, yay, was founded by an immigrant. And immigrants continue to fill many of its key leadership positions, including CEO. Instacart, which provided grocery shopping services for people who didn't want to go to the stores, became a lifeline for many American consumers, was founded by an immigrant. An immigrant from Taiwan who arrived in the US as an international student invented the N95 mask, which has saved the lives of many people during the pandemic. Zoom video communications. almost didn't happen because a Chinese-born immigrant was denied an H-1B visa 8 times before finally making it to the United States. Again, 59% of PhD researchers in life sciences and medicine in the United States are immigrants. Immigrants are key to our economy. They generate trillions of dollars in spending power. And looking abroad, remittances to countries like the Philippines. Immigrants in the United States send billions of dollars home, $11 billion to the Philippines, to India, $16 billion to China, $30 billion to families back in Mexico. So I wanted to give you, I know my time is almost up, I wanted to give you a very brief overview also of what the Association of Pacific Rim Universities is, because I think it will be of interest to you. It's, as mentioned, it's a nonprofit network of 55 leading, I think 56 now, leading research universities in the Pacific Rim, representing more than 500,000 university staff and 2 million students. The Secretariat is located in Hong Kong, and the Global Health Program is one of several programs, which the Global Health Program is housed at USC, where I work. The University of the Philippines is a member, and you can see some of the other member universities. But you don't have to be affiliated with the University of the Philippines or any member university in order to participate in our program. Right now, I am the lead editor, guest editor on a special edition of this journal, the International Journal of Environmental Research and Public Health, which has an impact factor of 2.95. The title of the special edition is called Patterns, Determinants, and Community-Based Interventions of Migrant and Refugee Help. Manuscripts are being accepted, and I would encourage you all to submit if you have something. We have extended the deadline a little bit until April 1st. We do have fee waivers available for people in low and middle income countries. So there's the link for more information. We also host an annual conference. It was in the Philippines about 4 years ago, maybe. This year, it will be held again virtually, November 16th to 18th, and the theme is Global Urban Health. Dr. Tigno, for example, spoke on migration at the conference in the Philippines. For those of you who are teaching, we have a series on teaching in virtual environments. This will be our, 7th series coming up this week. And it's an interactive 90-minute session with breakout rooms and sharing experiences and tips on how to teach in virtual environments. We also have a virtual global health case competition for students. So teams of 4 to 6 students are given a challenge on April 2nd, and they have 10 weeks to prepare a hypothetical program, outline a response, and create a 10-minute video, which is then judged by an international panel of judges. We choose 3 finalist videos. Those videos are screened at our annual conference, and the winners receive, I think it might even go up this year, but last year it was US $500. So I would just like to end saying that we must make sure that the contributions of migrants are not forgotten, but instead rewarded. Since the founding of the United States, immigrants have played a key role in creating a dynamic and growing US economy. And this role has become even more important during the pandemic. Thank you so much for inviting me. It was my pleasure to speak to you today.